So I've actually attended this symposium for the last 3 or 4 years. So it's a real privilege to be invited to speak this year. So thank you very much again. Um, so my presentation is on group acupuncture and supportive cancer care. And the title is We Were All in It Together in a Way. And we'll come on to that later. So a little bit about me. You've just given me a great introduction, but so I've been an acupuncturist for 25 years now. Um, I was in private practice for a number of years, bringing up a young family, but then I started working in a hospice in 2011, where I first had experience of palliative care patients. And also that's when I first started working in a group. And it was through that group work in the hospice that I was asked to set up a pilot few hours a week in Dimbleby Cancer Care, which is an integrated supportive cancer care department in Guy's Hospital in central London. So I was a pilot project for just a few hours a week, but we had great outcomes. And through lots of hard work and keeping going, I've managed to make that more of a permanent position with 4 clinics and significantly more hours and time for our patients. It was through my work in the NHS that I became interested in research, realized I actually didn't know how to go about doing research. So embarked on an MSc, which I completed just over 2 years ago now. And my research project for my master's, which was comparing group and individual acupuncture, won the Research Council for Complementary Medicine Prize for best early career projects. And that's what I'm going to present a little bit about today with some cases. So brief outline, I'm just going to describe my service in Dimbleby Cancer Care and where I fit in the hospital. Then a little bit more about my research, and I'm going to illustrate a couple of case studies at the end. Okay, so Dimbleby Cancer Care, as I said, we are a fully integrated supportive cancer care service set within a cancer centre in central London. It's made up of 4 teams. There's a complementary therapy team, and the acupuncture service sits within that. But there's also a very large psycho-oncology support team. There's welfare and benefit support and info nurses. So we all work together to a certain extent. I was brought in, as I said, back in 2016 to an already existing complementary therapy team. So initially, though, I was the only acupuncturist, and we're still much smaller than the rest of the complementary therapy team, which is made up of touch therapists, aromatherapists, reflexologists. But I'm doing my best to try and expand that service and get more funding. As you can see, the photo of me here is my colleague James, who I work with on the group acupuncture clinic. And so we now have group acupuncture, individual acupuncture, and also a NADA auricular acupuncture clinic that's run by one of the complementary therapists. So these are images of my 2 clinic rooms, looking at the group and individual clinic setting. So the picture on the left is the individual therapy room, very recognizable as a very lovely therapy room. And the image on the right is the group acupuncture clinic room. And as you can see, this is seated. So patients will come in and sit on the recliner chairs. We have nice lighting, nice images on the screen, gentle music. It's a really calming, lovely atmosphere, particularly within a cancer centre that's very clinical most of the time. All patients have to be referred by another healthcare professional to come into the service. So most of our patients come through their cancer nurse specialists, but I also get referrals from oncologists or physiotherapists or occupational therapists. Occasionally, patients wander in to the service and want to self-refer. We have to send them back and they have to be referred in. Each patient can only have 6 sessions. Unfortunately, I'd love to be able to give more, but we just don't have capacity. There's only a few of us, and we're only there a few days a week. And we already have very long waiting lists. But as you'll see when I present a bit later, there's a lot you can do in these 6 sessions. So the appointments are every 15 minutes. The patients will come in, sit down, we'll do a full consultation. individualized TCM consultation. The chairs go back, needles are put in, move on to the next person. There's 2 of us that work in this room, so we only have to see 2 people an hour. That gives plenty of time for that follow-up discussion at the end. Lifestyle advice, there's a lot here, and you'll see this in the cases that I present later, that fits in very well with some of these earlier presentations we've had about self-help and acupressure and safety. Right from the very beginning, I've always gathered outcomes. I've been interested and felt it was important to know that my patients were benefiting from the acupuncture, and also to show this to the wider hospital. It was quite unusual that I was brought in as an acupuncturist within the service, so I thought that was always quite important. So I used my core measure, your self-concerns and well-being. It's a validated outcome measure where patients give their 1 or 2 concerns that most bother them, as well as well-being, and they rate this out of 7 points, so between 0 and 6, where 6 is as bad as can be and 0 is as good as can be. And we ask our patients at the beginning of their first appointment and at the end of their last appointment to rate their concerns or symptoms. So I've been doing this for a number of years, and then I was interested in these outcomes and how I can show this. So that's when I embarked on my MSc in research. And so for my research project, I conducted a service evaluation of my clinics. I mentioned earlier, I'm a traditionally trained TCM practitioner. So this is the acupuncture they're getting, where every patient is individually diagnosed and treated. And we also use a number of adjunctive components, such as auricular acupuncture, a lot of TDP, heat lamps, indirect smokeless moxa. I can't use anything with smoke in our treatment rooms, ear pellets, and a fair amount of lifestyle advice as well. Okay, so my research was conducted over a 6-month period. You can see there were 43 participants in total, 28 from the group and 15 from the individual setting. And this is, the pie chart is a breakdown of the symptoms or the concerns that were brought up in that 6-month period. You can see, if we include chemo-induced peripheral neuropathy as pain, you can see that over 50% had a concern that related to pain. But there was also, with the second concern, there was a really wide selection of typical symptoms with cancer patients: hot flushes and night sweats, anxiety and stress, insomnia, fatigue, brain fog, lack of focus, and various others. If you took a snapshot of my clinics now, the one thing that would be very different is xerostomia, or dry mouth. I've since this time developed a good relationship with some of the cancer nurse specialists in the head and neck tumor team, and they send me a lot of xerostomia patients. So there's an element to which there's building relationships, and the different tumor group nurses and oncologists knowing about my service and referring people into the acupuncture clinics. Okay, so looking at the results of the research, I had a number of different aims. So the first one is, what are the symptomatic changes overall? And this graph is showing the change in scores, combined group and individual acupuncture, of all the patients in the period. So as you can see, the concern 1 and concern 2 was pretty high, almost as bad as can be, at averaging 5.4 and 5.2. And they dropped down quite significantly to 2.9 and 2.7. And with well-being, which is always going to be slightly lower, particularly in a cancer centre, dropped down to 2.2. So that's across both groups altogether, but very lovely to see that in just 6 treatments, the patients were benefiting from such significant symptomatic improvement. So the next aim, or the next graph, is how do group and individual acupuncture clinics compare to each other? So this is looking at those improved numbers and comparing the group with the individual clinic. And you can see for both concern 1 and concern 2, there was no statistical difference at all between the group and individual clinic. Slight difference in well-being, but this wasn't actually statistically different. this confirmed what I'd been seeing over the last few years working with those two clinics, but it was really nice to see in research terms that this was borne out. So I then wanted to look at the experience of acupuncture. I did do a fair amount of comparison between the group and individual experience, but there's not time to look at that in this presentation. So I'm just going to show you some of the comments that were made about the group. Obviously, I was able to hear other patients and then me talking of problems, but I didn't find it troubling. We were all in it together in a way. And as you see, this was the title of my my presentation. I think this is a lovely quote. There's a sense of being with other people was so beneficial to these to my patients coming into the clinic, that there was a synergy of the people there, that they were enjoying and hearing and being in this group situation. A peaceful meditative area with others wasn't an imposition. The sessions were very relaxing and provided me time. The sense of time came up time and time again, of being listened to, of knowing that they were able to come in here in this lovely cocoon space in the cancer centre and be with this group of people. It was an experience that came up multiple times. In a way, it's reassuring to see no other stories. Mostly I was able to close my eyes and zone out. Music helped. Frequently I have people snoring in the group by the end of their sessions. We're always quite amused by the snorers. There were one or two people that said they would have preferred to be in a one-to-one session, or they didn't really like hearing other people's stories. It wasn't very many. There were one or two, but there were a few. And I'm just going to talk about that briefly in a moment next. The last thing I wanted to do was try and see if there's any relationships between symptomatic change and the patient's experience. So if they didn't improve in symptoms, did that affect their experience? Or if they didn't like the group, did this impact their symptomatic improvement? I really wanted to try and unpick the group. Well, it was very heartening to see that the vast majority of all patients had improved symptoms and a positive experience. So that was almost everyone. For those few patients that had either unchanged or worse symptoms, and this is always going to happen, particularly in a cancer centre, all of those patients had a positive experience. And this is picking up those non-specific effects of acupuncture, the consultation, the diagnosis, the therapeutic relationship. So even when their symptoms weren't great, there was still a very positive experience of coming in and experiencing acupuncture. And then that final relationship, which was new to me and I hadn't seen anywhere else, is the few people that expressed a negative group experience. So there were one or two people, as I said, that just didn't particularly like the group. They still had improved symptoms. In fact, the person that had the largest symptomatic improvement said she would have preferred to be in a one-to-one clinic. And I think this is really interesting because it shows that the group experience itself has no impact on symptomatic change. So I have been disseminating and publishing this research for the last couple of years. So I published it in Supportive Care and Cancer, and here is the link. I've presented at various conferences and webinars, but I have also, through publication, presented to the management of my hospital. I'm always trying to expand the acupuncture service. The acupuncture is the smallest group within Dimbleby Cancer Care. And on the back of this research, I was able to get funding for our satellite hospital. So there's various satellite hospitals related to this trust. It's very large, and there's a Dimbleby Cancer Care in this satellite hospital, and it had all teams of Dimbleby Cancer Care except for the acupuncture service. And on the back of this research, I was able to expand and set up another seated acupuncture group, and this is my colleague Oksana, who's now running this group. I think this is really important because it's running a group acupuncture clinic is cost effective, it's quite easy to set up, you don't need very specific clinical rooms, and this shows that the outcomes are equal to the individual acupuncture setting, and the experience is very positive for the patients. So if you're able to expand or trying to approach somewhere to try and set up an acupuncture clinic, I think this is really good research to try and do so. I'm now going to just present a couple of case studies that I've seen recently in the group. These are both very typical. I just selected them because I've seen them most recently. I'm always taking consent to be able to present my cases. So, recent cases who were happy to be presented today. I also think these are really lovely examples of everything we've been learning about today, and you'll see this later. So my first case is a 54-year-old male. He had head and neck cancer and had recently completed chemoradiotherapy 9 months ago. He didn't have any lymphedema. I often have to ask this question with my head and neck cancer patients. Sometimes it's very obvious. Radiotherapy can cause lymphedema, but actually sometimes it's really not obvious. So I do always ask that question. His main concern was xerostomia, particularly at night. He described there was a lack of saliva and a dry mouth. Often I find my patients do separate those two symptoms, even though they're considered one. He was also waking frequently because of the xerostomia, and then had difficulty going back to sleep, so was very fatigued. He had difficulty eating, still had taste issues, he had oral thrush, and he also had experienced some osteonecrosis in his left lower jaw due to the radiotherapy. His pulses were quite slippery in the upper jowl, a bit floating, wiry. In the middle jowl, he had this thick white yellow coat, which I'd often see with oral thrush patients. The xerostomia for him was 6 out of 6, as bad as can be. His fatigue was 4 out of 6. His well-being was 2. That was pretty good. He was actually had pretty good spirits considering his signs and symptoms, but they were really bothering him. So he, like so many of the patients that I see in the clinic, had a very mixed presentation. There's clearly a lot of toxic heat, underlying yin fluid deficiency with some phlegm obstruction. So these are the points I did at his first appointment. I almost always start with yin tang. I find it's calming, it's relaxing, particularly in the group. It's a nice point to start with. I did needle REN 24 with him, but that was after checking whether there was any lymphedema. I wouldn't normally do this point if I think there's any swelling or lymphedema. I used large intestine 2 to clear heat and combined that with 3 auricular points, Shen 0.0 and salivary gland. These have been shown in some research to be really effective with xerostomia, and I find that combination really works unless there's a specific reason why I don't want to do it. It's clearing that toxic heat. I then used Luden 5 and spleen 9 to clear heat in his lungs, distend the rebellious qi, resolve damp, tonify his spleen with spleen 6, nourish yin, and I also needled local point stomach 6 because of this pain he had in his jaw. It's a little diagram here of his progression. So after his first treatment, he noticed huge improvement after 48 hours, more saliva. He generally felt more comfortable. Over the next couple of treatments, he noticed his fatigue was improving, his taste was improving, he was sleeping a bit better. I mean, his fatigue has improved enough that he was able to do a park run. He was really, really happy about that. So some of the adjunctive components just going along that bottom. And this is, as I said, so interesting compared to everything else we've heard about today. I've contributed to a cancer-related fatigue resource pack, which is part of the complementary therapy team. So there are some acupressure videos in there. There are some qigong videos. There's some guided meditations. I sent that to him, suggested he pick one of them, the thing that spoke most to him, and try and integrate it into his day to help him with that fatigue. I also always gave him ear pellets on salivary gland and Shen when he left. The complementary therapy team give out aroma sticks to our patients. They get asked what they most like, but I have suggested they get a lime aroma stick. Lime has been shown to increase saliva glands, so he can use the lime aroma stick, particularly before he eats. I encouraged nasal breathing. I find a lot of xerostomia patients are also, they find it difficult to close their mouth. They often breathe through their mouth, to try and encourage some level of nasal breathing. And then more recently, I've given him some Qigong mouth exercises. So my colleague Oksana, who I mentioned earlier, recently went on a medical Qigong course. And one of the things she learned about were specific medical Qigong mouth exercises, which were new to me up until a few months ago. So I've now integrated those into teaching them to my xerostomia patients, and they are really useful as well. So going back to his progression, mid-treatment, he had a dental procedure for his oral thrush. I wasn't quite sure what, I looked it up, I wasn't quite sure what he had done, but everything was worse after that. He really didn't feel well at all. So the xerostomia was much worse. He wasn't sleeping, but I kept going with the treatments. He also said the jaw pain improved each treatment for just a few days, but always came back. And by the end of his treatments, he found that the xerostomia wasn't noticeable during the day anymore. He was eating much better. He'd put on weight. He wasn't waking at night. His fatigue had improved. So all of these things together had really improved his concerns, his symptoms. He's also had a procedure on his jaw to remove some loose bone. This is something that came up during the course of the treatments, and his pain had completely gone. So I tried to improve that with acupuncture, but actually I think that procedure was the thing that really helped the pain in his jaw. So at the end of his 6 sessions, his xerostomia, he said, had improved from 6 out of 6, as bad as can be, down to 2. His fatigue had improved from 4 to 3, and his well-being, it wasn't particularly bad to start with, and he was still 2. And he said, I've really enjoyed each session of acupuncture. I've noticed some improvement in my condition despite other complications. Thank you. He's also, often in the group, there's 1 or 2 patients that cancel, can't come in. They have ill health, clashing appointments, holiday, something comes up. So I've been allowed, because this was a bit of an administrative nightmare to get this to happen, but I've allowed my previous patients to just drop in and hopefully pick up cancelled appointments. And he is someone that has now come in on a few occasions, feeling like having his top-up appointments is really valuable to him, just keeping him at a manageable level. Okay, so my second case is a 56-year-old female. She has breast cancer, a recurrence from 10 years ago. She had, I think it was 6 months ago, I didn't actually write this in my notes, but before I saw her, a mastectomy on the left-hand side with sentinel node biopsy and chemotherapy. So she'd had lymph node removal, so I wasn't needling on her left side at all. She'd been on tamoxifen for 10 years and had recently been moved to letrozole. She was coming to see me with severe night sweats, also very common. I see this a lot. She was waking up drenched up to 7 times a night. Her hot flushes during the day were there, but manageable. She felt it was the nighttime that was a real issue. Another instance of just not being able to sleep and fatigue. She described the heat as rising up. She had anxiety in her chest. She described it as her chest, as real anxiety in the upper jowl. And she had a deep ache in both hips, bilateral hips, was worse after walking or any exercise, often the case when women are on aromatase inhibitors. She had quite a classic floating empty kidney shoe pulse. It was also a bit slippery, and her tongue was quite peeled at the sides. Her night sweats were, in terms of her MyCore scores, were 6 out of 6, as bad as could be. Her hip pain was 4 out of 6, and her well-being was also 4 out of 6. So on her first treatment, sorry, I'm just moving something. Also, I needled yin tang. I used Renmai, lung 7, kidney 6, to nourish yin, move fluids. Kidney 2 to clear the empty heat, spleen 6 to tonify the spleen, nourish yin, resolve damp, kidney 7 to alleviate the sweating, and spleen 3 to resolve damp. because the pain in her was in her hips, I palpated the Xiao Yang channel rather than just selecting points. I wanted to see which I felt was most stuck. And so on her first treatment, I needled Sanjiao 5 and gallbladder 39 to try and open and move the qi in the Xiao Yang channel. I gave her Shen ear pellets at the end of the treatments. I also sent her some acupressure videos, slightly different actually to the ones in the cancer-related fatigue. I also recorded some acupressure videos during the pandemic for just anxiety and stress reduction, and tried to talk to her about integrating some of these acupressure points along with breathing exercises. Sorry, yeah, are we near the end? 5 minutes. To try and do these breathing exercises and acupressure during while she was having a hot flush. And as I said earlier, lymph nodes, she'd had lymph nodes removed, so I avoided needling her left arm. So her progression over the course of her treatment, her first treatment was she was amazed. She'd had no sweats at all for 5 nights. She still felt she was getting anxious, and she hadn't noticed any change in her hip at all. I shifted points around with her. I didn't shift them all every treatment. These are just a selection of the points that I used over the course of her treatment, including Daimai, because I didn't feel like I was really getting into that hip issue. And I also added in NADA alongside the body acupuncture midway through the treatment. So she overall her sweats were improving. She didn't have 0 sweats like she did for that first week, interestingly, but overall they reduced enough that she felt it was very manageable. Her hips improved all the way through to hip pain went away altogether. She did seem to get migrating pain, sometimes in her foot, sometimes in her elbow. I find that with women on aromatase inhibitors, they seem to have migrating pain. It does seem to move and generally decrease. And she was sleeping really well by the end and felt like she was really in control of her symptoms. Her pulse changed quite significantly, actually. I think over the course of the treatment, her tongue didn't really change. So at the end of her treatments, her night sweats went from 6, as bad as can be, down to 2. Her hip pain went from 4 to 1, and her well-being went from 4 to 0. And at the end of her sessions, she said, having acupuncture here really helped me to focus on my physical and mental well-being. Best part of my cancer treatment journey. Thank you. And she particularly loved the group. Because I wasn't collecting group data at this point. She didn't mention it, but she particularly loved coming in and being part of the group. So in summary, group acupuncture is cost effective and it's equally effective when compared with individual acupuncture, and it's a really positive experience for the patients. This may be relevant for any future planning of acupuncture services in supportive cancer care. And hopefully you can see from these treatments, you can get great results in just a few treatments. Thank you for listening, and here is my email should anyone wish to contact me.
Well, thank you for the great presentation, really clear, inspiring, and not just for the opportunity of kind of promoting group clinic, but also for the choice of point, for the insights I got from this presentation, and I'm sure everyone else. So thank you, Mandy.
You.
Thanks a lot.